What if the problem isn't whether statins are good or bad, but that we've been asking the wrong question this entire time? Most people are stuck on, should I take a statin? That's not how I approach it. Statins are a tool. They inhibit an enzyme that causes a reduction in hepatic cholesterol synthesis and upregulate LDL receptors, and yes, therefore, lower ApoB. But that's just one layer of physiology, because statins don't correct the environment that those particles are operating in. They don't restore endothelial function. They don't rebuild nitric oxide signaling. They don't resolve insulin resistance. They don't fundamentally shift inflammatory tone. And in some patients, we see trade-offs. We see increased insulin resistance. We see mitochondrial strain. We see muscle symptoms, fatigue, cognitive function decline, and a sense that energy production is not efficient. So the real question then becomes, what problem are we actually trying to solve? If someone has unstable plaque, established disease, or a compressed timeline where risk needs to come down quickly, using a statin makes sense. But if we're looking at a woman in midlife, watching her lipids shift as estradiol declines, developing insulin resistance, losing vascular flexibility, becoming more inflamed, that's not a statin deficiency. That is a systems level shift. And when you treat a system problem with a single downstream lever, you may move a number, but you have not restored physiology. So I try to zoom out. I'm looking at inflammation. I'm looking at insulin signaling. I'm looking at ApoB in context. I'm looking at lipoprotein(a). I'm looking at endothelial function and hormonal status, because these particles don't act in isolation. They behave based on the environment that they're in. If you don't change the environment, you may be managing some risk, but in some patients, the collateral damage of the blunt tool that statins are can mean elevated risk in other levers of vascular resilience, such as fibrinolysis and elevated lipoprotein(a), or insulin resistance if someone is already borderline, or energy depletion in cardiac and brain cells leading to inefficient use of energy and ultimately decreased function. We want to know the various inputs, the physiologic story that the body is trying to communicate, and address as many unifying contributors as possible for a holistic cardiovascular health picture, and not overly rely on one number and one blunt tool to get us there. That is the conversation that actually matters.